Power Initiative, Detroit Future City, and the Detroit Urban Research Center. So today, I'll explain a little bit about the Detroit Environmental Agenda. We have many steering committee members that are here, and this event is a part of that effort. We'll also have Dr. Kimberlydawn and Habitz from the Henry Ford Health System to speak a little bit about their approach to healthy environments and community well-being. And then we'll have Dr. Jackson speak, which will be followed by discussion and question and answer session. So the Detroit Environmental Agenda is a collaborative project that was intended to raise the awareness of environmental issues, conditions, and opportunities in Detroit with residents, the general public, and our policymakers. And this was done in partnership with Great Lakes Pioneers Detroit, Southwest Detroit Community Benefits Coalition, EcoWorks Detroit, formerly known as Warm Training Center, Zero Waste Detroit Coalition, Data Driven Detroit, Michigan Environmental Council, Michigan Trails and Greenways Association, now Detroit Greenways Coalition, Southwest Detroit Environmental Vision, and Recycle Here. We went to a lot of different community groups and neighborhood associations and block clubs to collect information and share about environmental issues in Detroit. And we sent out a long survey of all the different environmental issues that might be going on in neighborhoods. And sorry, that's an impossible slide to read, but we got a sense of issues that people care about in their districts. And although dangerous structures and crime was understandably a top issue for many, it also included high energy bills and high water bills and lack of recycling and litter and poor air quality in places especially like Southwest Detroit. We took candidates for our first council by district election on district-based bus tours to hear from residents and advocates about the different environmental issues and conditions in their neighborhoods, so that the people who would represent them on council would know what neighborhood conditions are like, especially from an environmental perspective. And in putting together this report, we have not very many hard copies left, but we do have copies online available. We put together a set of recommendations that were about all aspects of the environment. There are a lot of really wonderful environmental initiatives and coalitions working on certain areas, but we wanted to put together a report that looked at the environment as a whole. And so there were things like the need for clean energy. We have coal-fired power plants, and our use of energy is putting carbon and sulfur dioxide into the air. We're actually not in attainment for sulfur dioxide. But steps like the city going to all LED for our public lighting and starting to use different modes of clean energy, like some buildings downtown, are moves in that direction. We need clean air. This map over in the corner is the Tri-County map of asthma hospitalization by zip code from over 2007 to 2009. And you can see that it's much, much higher in Detroit versus the rest of the three county areas. We can do better in managing our waste. So with the thousands of demolitions going on, we have an opportunity to salvage that through deconstruction. And then also with our municipal waste, where we burn most of our waste in the waste to energy facility, and our recycling rate at that time when we did the report in 2013 was about 3%, which is far below the national rate of 27%, and way below San Francisco's top of the line rate of above 90%. And this map, we need green and healthy homes. This map here, it's a statewide map from 2011 of children with elevated blood levels. And you can see that over half of the children in Michigan who have lead poisoning are children of Detroit. So there are, and then the rest are in these very urban areas like Flint and Ben Harbor and so on. So that is a very big disparity. And there are groups like the Green and Healthy Homes Initiative and Clear Cord and others working on improving our housing conditions. We need We have, in some parts of Detroit that were developed later, we have great buffers between our residential areas and, say, the CSO holding station on the east side or the Coal Town plan. But on the southwest side, where you have a longer history of residential next to industrial, there are no buffers. They're right next to the highways, they're right next to the plants, and they breathe it every day. And I believe that people should spend a lot of time in Southwest Detroit to truly understand the problem and smell it. So, I just wanted to get a sense of who's in the room. There was this wonderful bookmark handed out by Henry Ford earlier today in an event that said the time is always right to do what's right. And often we think that, oh, we're coming out of bankruptcy, we have too many problems, we can't think about designing healthy communities, that's a luxury. But I was encouraged by this quote that the time is always right to do what's right, and the same care that we take into rebuilding our financial systems coming out of bankruptcy, we should put towards rebuilding our physical environment so that everybody has a chance to thrive. So with that said, before I turn it over, I just wanted to get a sense of who's in the room. Could you raise your hand if you are from the medical field? Wonderful. Could you raise your hand if you are from planning or architecture? Could you raise your hand if you are from community development or organizing? Okay, I'm sure there are lots of overlaps. Could you raise your hand if you are in environmental justice or sustainability? Could you raise your hand if you're involved in transportation or infrastructure? Great. And could you raise your hand if you are a policymaker, whether in elected office or working for an elected official? Wonderful. Thank you. And I would love to recognize, I believe, State Representative Stephanie Chang. Thank you so much for coming here. And are there other elected officials in the room? Okay, thank you. Thank you. Thank you. Wonderful. Now we'll have Dr. Kimberlydawn with us to share.
Thank you, Sandra, and wonderful job. And I am absolutely delighted to see you here. I'm Kimberlydawn Wisdom. I serve here at Henry Ford Health System as Senior Vice President of Community Health and Equity and the Chief Wellness and Diversity Officer. And I want to say on behalf of our senior leadership team, Nancy Schlichting, Bob Riney, Nancy is our CEO, and Bob Riney is our Executive Vice President and COO, and Wright Lassiter, our President. We are absolutely delighted to have you here. And I want to applaud the planning committee that put this meeting together. You know, as we were planning Martin Luther King Day, we thought we'd bring in Dr. Jackson and really drive an agenda. Typically, our Martin Luther King Day efforts are very inspirational. But this year we thought, let's bring somebody in to really help drive an agenda, what we care about, what Tom Habitz, who you'll hear from in a minute, really cares about. However, I didn't realize that the agenda was really the environmental agenda here that Sandra and many of you care about. So I love looking around the room, seeing so many unfamiliar faces, because it means we're really moving into a space where we can grow and learn and further work together and collaborate. Because truly we believe that health occurs where people live, learn, work, play, and pray, the social determinants of health. But how do we operationalize that? You know, we're health professionals and we're, clinicians, and how do we make that happen? Because we know it's important for our patients and for our community. But the faces and the people and the juice and the energy in this room are what's going to help us make that happen. So we really look forward to working together with you. I want to say that you're in the Innovation Institute, so you're in the perfect place for wild ideas, so please don't hold back as we have the conversation. And this is the very stage where Henry Ford himself would confer diplomas on for the nurses. So you're in a very historic place. This is our 100th year, starting in 2015 at Henry Ford Hospital. And of course now Henry Ford Health System has been in existence. So we're really celebrating our growth and moving forward. So this is quite fortuitous that we would be meeting with a group like you as we're moving into our new agenda. We have many sectors represented, as Sandra already demonstrated: health, community development, architecture, foundations, government, elected officials, and other stakeholders that we don't typically talk to. So this is designed to be a conversation, and boy, this group pulled it together in a week. And I tell you, when I want to have another conversation, I'm going to know who to call on to make it happen. We had Dr. Jackson this morning speak to us related to for our annual Martin Luther King Day celebration, and he did an awesome job. And now this is sort of the next iteration of that. We're thrilled also that the Urban Family Foundation is co-sponsoring this, so please give them a warm round of applause. I know we have Jody Raines here. Thank you so much, because you're just the Detroit Environmental Agenda folks and who have helped host this effort. It's just so important how we've come together. Henry Ford Health System believes and knows it's critical for health and the medical community to address the built environment, and we have about 30, Tom will be talking about all the exciting things. Tom, I'm sorry, people excited about the stuff you're doing, and I start, but I'll leave that to you. But we care a lot about the built environment and really how it impacts the health of our employees, our patients, and the community at large. We also know that when we look at the work that McGinnis did in about 2002, that healthcare delivery is only a small part of truly health, 10, maybe 20%. We know the environment, we know behaviors, we know other things actually are much greater predictors of health. However, when you need a really good heart surgeon, you want to go to a really good doctor too in a place like Henry Ford. We also know that your zip code is a greater predictor of your health outcome than your genetic code in many instances. So we're really excited to continue this conversation. Also, we want to be a part of this tremendous conversation, and we know that as the city of Detroit moves forward in building the built environment, we want to be very much a part of that. We want to have healthier patients, healthier employees, healthier community, and overall a healthier population. So again, on that note, I want to thank you all for coming out tonight and looking very forward to an exciting agenda. And at this point, I think I'm going to turn it over to, I believe, Tom, who is our urban planner par excellence. We have tremendous respect and regard for him. And he is in the Department of Neighborhood, I think revitalization, but it is neighborhood redevelopment, and I'm sure he's going to be revitalizing our neighborhoods too. So looking forward to being part of the conversation, and looking forward to long-standing collaborations with many of you over the upcoming next 100 years. Thank you.
Thank you, Dr. Wisdom. I'm going to be really brief, but I wanted to say a few words about our comprehensive community revitalization program that's occurring south of the Boulevard. Many of you in the room may be aware of some of that work, but it's something that we really feel kind of takes the commitment of Henry Ford as an institution to the next level. There's a really nice tradition of universities and health systems getting more involved in the communities around them, especially in urban environments, and that's true in Detroit as well with some of our institution partners. But we're getting especially involved in the communities that surround us, in partnership, with a number of different folks. And I was talking with Dr. Jackson just before the program started here, and we both kind of remarked simultaneously on what an opportunity that really presents, for an institution with the history, the resources of Henry Ford to get involved in some of that work. And to really touch lives. And what it really does is further our mission and our vision, which is to transform lives in communities through health and wellness. And we really see the connection between real estate development and community development and the operations that we have here on this large campus. And it's something that we really want to further. And the fruition of those programs, really we feel will be the best local, kind of tangible example of the intersection of health and wellness, and community development right in the ground in communities that are important to us, in communities that we live in and that we want to stay in, for another 100 years as we kind of see the see the centennial through. Our program is a multifaceted community program with as many partners as are interested, living in the neighborhood, investing in the neighborhood, and seeking, the health system out for care and the resources that it offers. The way that health has been involved in our planning, along with the community, is really, number one, is a motivating factor to create a healthier place that has accessibility, that is vibrant, that has opportunity. But it's also something that informs the plan as we go along, modify it during different iterations of it. And it's going to be how we measure our success ultimately. We won't be successful living in a silo. We won't be successful living in an environment with four walls around it that don't feel like they're a part of the neighborhoods that we serve, or that have a large differential in the prosperity between what's inside walls and what's outside them. So our mission is really to try to tear down those walls and create fuzzier barriers between the institution and our communities. And we think we're on our way to that through partnership and through some specific development projects. So on a holiday like today, we like to emphasize how big we like to dream, and so we have a set of goals around that, and that's to be a completely blight-free community in the neighborhoods around us and the commercial corridors that feed into this area, and to restore the historic identity of the area, the historic structures, to bring them back up to code and back to usability, and to bring back the density that made this area historically a very active and vital one. Opportunity is certainly a big part of that, and there's a connection between health and economic opportunity, and a lot of that is within the walls of the institution, but it's outside of that, and getting involved in creating connections that will allow people access for that, and to really address kind of the regional mismatch we have between where jobs are located and where people are living. So we need more people living around here, and we need more jobs here to serve them. We need them to have access to them. And ultimately to have a clean, safe, investment-ready, competitive, with any other neighborhood across the city or across the region, and accessible area. So those are the ambitions that we've kind of laid out. There are a number of programs in place that we think are leading us toward a lot of those outcomes right now. And it's a great time to launch a big celebration and observance of some of those key goals and specific projects coming this year. So stay tuned for more. We certainly anticipate. So with that, I'll turn it over to the next speaker.
I'm going to introduce Sandra down to Jackson. We're thrilled to have Dr. Jackson here with us today, a national expert on environmental health who started out as a pediatrician, going on to become the National Director of Environmental Health Sciences at the Centers for Disease Control and the State Health Officer in California, and now a professor of environmental health sciences at UCLA's School of Public Health. And this part was also very interesting to me. He's also an honorary member of both the American Institute of Architects and the American Society of Landscape Architects. So he is able to bring together medical, environmental health, landscape architecture, and public policy into his perspective.